Once you have chosen an appropriate RehaMove training program and you have configured the channels, you will be forwarded to the parameter selection window. Depending on the injury of your patient, a spinal cord injury, stroke, or others, you can choose between predefined templates. Press the corresponding button for the patient's injury and choose one of the templates by rotating and clicking the knob. Furthermore, you can individualize any of these templates depending on your clinical needs. Now, we choose the SCI First Therapy Session template, one of our most commonly used templates for a patient's first FES session. Press the Individual button. In the next window, you are able to change the values of this predefined template by pressing the button next to the value you want to adjust. Please turn the knob to set up new values and confirm your entry by pressing it. Press the Next button to start the current test. Depending on your channel configuration, the next window will show your selected channels and corresponding colour-coded muscles. The first colour stands for the side of the body. Yellow is right and green is left. The other colour stands for the cable connector and thus your selected muscle. Start the current test for each channel by pressing the corresponding button next to the channel. When you have selected the first channel, in this video the quadriceps for the right side, a column appears. Use the knob to adjust the current for each channel. When you see the yellow bar on the top of the screen, please be aware that stimulation is active. Confirm your entry by pressing the knob. After you've completed the current test for each channel on the right or yellow side, you have to press the Next button to be forwarded to the current test for the left or green side. The procedure is the same for each channel and side. Please be aware that each patient has an individual sensitivity and motoric threshold. Please carry out the current test for each new training profile with patients and handle them with care. Once you have completed testing the current for each channel, the last step is to name your profile. On one side, you have access to predefined names by pressing the third button on the left. On the other side, you can insert an individual name with a minimum of 2 and maximum of 12 letters or numbers. The profile is saved by pressing the Save button, the fourth on the right. The next window will show you an overview for your selected training profile, channels, muscles, and parameters. In this video, our patient has a training profile for RehaMove leg training in constant mode. We named this profile First Session. The overview shows that we have chosen a bilateral training, left and right side, with the muscles quadriceps, biceps femoris, tibialis anterior, and gastrocnemius. The corresponding numbers stand for the current values set up during the current test. In addition, you see the values for frequency, pulse width, and the ramp. The warm-up, stimulation, and cool-down time is shown in the last line. If you want to edit any of these parameters, please press the Advanced button, the third button on the left. If you press the Back button, you'll be taken to the Start screen of the RehaStim 2. To create new or additional profiles for this patient, please press New Profile, the third button on the right. To start the therapy session with the MotoMed, please press Start Therapy Session.